Hello, and welcome to Know Diabetes by Heart. We're excited you've joined us today and taken the initiative to learn more about diabetes and its connection to heart disease. I'm Valeria Cohen, an alumni of the American Heart Association's Scholar Program, and I will be guiding you today through this health lesson. In today's lesson, we will talk about what is the Know Diabetes by Heart initiative. We will review what is diabetes and discuss its link to heart disease and stroke. We'll also learn practical actions to take to reduce your risk of heart disease and stroke, and we'll provide you with helpful online resources where you can find much more information. Our goal is to help you increase your understanding of the connection between diabetes and cardiovascular disease, to help you take charge of your health and live a longer, healthier life. So let's get started. Have you heard of Know Diabetes by Heart? Many of us don't associate having diabetes with an increased risk of developing heart disease. Know Diabetes by Heart is an initiative by the American Heart Association together with the American Diabetes Association to help people living with diabetes lower their risk for cardiovascular disease. So what will we hope for you to gain by the end of this lesson? So we hope that by the end of the lesson, you will have an increased awareness about diabetes and its link to heart disease. We want you to be able to modify your risk factors. That means identify the changes that you can make that will have the largest effect on your health. We want you to be able to manage your condition better, engage with your team of doctors to have the best plan in place to manage your diabetes and other related health conditions. And last but not least, we want to motivate you to be your own best health advocate and join the Know Diabetes by Heart initiative. We all probably know a family member, friend, or ourselves are dealing with elevated blood sugar levels, or maybe we've already been diagnosed with diabetes. In fact, more than 37 million Americans have diagnosed or undiagnosed diabetes. Diabetes is a condition that causes your blood glucose or blood sugar levels to rise too high. However, we should know diabetes is not just a blood glucose problem. Over time, these high glucose levels may damage your eyes, kidneys, nerves, or heart. It causes damage to your blood vessels that make it more likely to develop heart disease and a stroke. Let's discuss diabetes a little further. When we eat, the digestive system breaks down food and our blood sugar levels rise. The body's cells absorb this sugar or glucose and use it for energy. The cells do this using a hormone called insulin. And this way, your blood glucose is kept at normal levels. But when you have diabetes, your body does not make or use insulin properly. This is called insulin resistance. And this causes your blood glucose levels to rise too high in your bloodstream. So, why do we develop diabetes anyways? As you may well know, there's different types of diabetes. Type 1, previously known as juvenile diabetes, is a chronic lifelong condition. There's gestational diabetes, which may develop for the first time when a woman is pregnant. And type 2 diabetes, which we may develop because of a combination of family history and environmental factors. Of the 37 million Americans that we previously mentioned currently living with diabetes, 90 to 95% of those people have type 2. For this reason, our discussion is focused on type 2 diabetes. Let's now discuss your risk for developing type 2 diabetes. You might be more likely to develop type 2 diabetes if you're Hispanic, Black or African American, American Indian, Asian American, especially South Asian, Native Hawaiian, or Pacific Islander. Now, this might be a little confusing, but studies have shown that you might be more likely to develop type 2 diabetes because of a genetic predisposition. However, genetics isn't everything. Just as important are environmental factors and lifestyle factors. Both a family history and lifestyle factors play a role in developing type 2 diabetes. For example, if your parents or a relative have diabetes, your risk is increased. You may want to keep your weight under control, add healthy food choices to your diet, and try including more movement in your day to day. Now, we all know these are healthy habits that do us all good, but are particularly advised for managing your diabetes. So, we encourage you to know your risk factors and share your family history with your doctor. Early detection and treatment of diabetes can help reduce the risk of developing complications from the disease. Okay, let's further just a little bit our understanding of how type 2 diabetes is linked to heart disease. As we've said before, and you well know, type 2 diabetes causes blood glucose levels to be too high because the body does not produce or use this hormone insulin. And as the slide says, insulin is the hormone that helps the body use the blood glucose. So what happens? Glucose levels remain in the bloodstream and they're too elevated. As a result, your body's cells are starved because they're not receiving this glucose for energy. The body responds by increasing levels of fatty substances in the blood. And over time, this results in a buildup of plaque in blood vessels. This buildup of plaque makes arteries smaller, making it harder for blood to flow through. This plaque can also clog arteries, leading to a heart attack, stroke, kidney disease, or heart failure. If you're taking the time to watch this health lesson, I can imagine you want to live the longest life, but also the healthiest life. And living a longer, healthier life with type 2 diabetes starts by knowing the link to heart disease. Managing your diabetes helps prevent damage to your blood vessels. And people with type 2 diabetes already have double the risk of heart disease. But you can change that. Besides managing your diabetes, make sure to manage other health problems like high blood pressure, high cholesterol, or kidney disease. Try to change unhealthy eating habits and physical inactivity that also put you at higher risk for developing cardiovascular disease. You can take steps to prevent a heart attack or stroke and also improve your quality of life. Now that you've identified some changes you can make to improve your health, we encourage you to get help from a trusted healthcare provider. Type 2 diabetes is a condition that has become much more manageable given better treatment options and new medications on the market. When you go see your doctor, here are 4 questions you can ask about diabetes and your heart. What can I do to lower my risk for heart disease and stroke? Do any of my medications help me manage my risk for heart disease or other complications? Are there programs that can help me manage my condition? And can you give me a referral? How can I meet others going through my same experience? Now we're hoping you should feel a little bit more informed and confident to take charge of your health. Let's review some good points on our self-care checklist. 1, make sure to talk to your doctor or another healthcare professional at your next appointment about ways to reduce your risk for heart disease and stroke. 2, make lifestyle changes, including following a heart-healthy diet, reaching and maintaining a healthy weight, being physically active or moving more, and not smoking. Let's add to our self-care checklist number 3, properly manage stress. 4, monitor and keep track of your blood glucose, blood pressure, cholesterol numbers, and weight. 5, take medications as prescribed. And in addition, if you have already type 2 diabetes, 6, get an annual kidney health screening. Now, let's take a quick true or false quiz together to assess your understanding of some of the important information we've covered today. Seeing your doctor regularly can help you manage your diabetes. If you answered true, you're correct. Seeing your doctor regularly can help you stay on the right course of action of monitoring your diabetes. People living with diabetes are 2 times more likely to develop complications from heart disease. The answer to that question was true. Diabetes greatly increases your risk for heart disease and stroke. Managing your diabetes can be stressful. Yes, it's true. Managing your diabetes is stressful, but remember, you're not alone, and we'll provide you with additional resources where you can get support and help. If you live with type 2 diabetes, managing your kidney health is an important part of your overall heart health. True. If you have type 2 diabetes, make sure to get an annual kidney health screening. I can never eat anything with any sugar in it ever again. And the answer is false. The key is moderation and management. Talk to your doctor and make a plan together. And lastly, adding some movement to your day is a way to take care of your diabetes and your heart. True, more physical activity can be an essential tool for managing your diabetes. You don't have to make big life changes to see the benefits. Try building in more activity into your day. Start walking or do gardening if you'd like, or dance more. The key is to move more. You can learn more and join the No Diabetes by Heart initiative. We understand that your health is influenced by all the factors of your life, and we encourage you to visit nodiabetesbyheart.org, a website that provides you with the necessary tools and resources to support you on your health journey. Visit the No Diabetes by Heart website to take advantage of all the resources available to you, including healthy recipes, research advancement news, how to join a local support group and share your story and connect with others, and if you're a caregiver, information on caregiver support resources and tools. What about getting more expert advice about your diabetes? Well, the American Diabetes Association has an Ask the Expert series, which is a monthly live question and answer series. And each month, a different topic is covered. Any events you've missed are recorded so you can go back and watch. You can also check out a new online learning opportunity from No Diabetes by Heart that will help you learn more about diabetes and the risk of complications like heart disease and stroke, and how to take an active role in your health. You can scan the QR code or visit nodiabetesbyheart.org. And to remind you, you're not alone, the American Heart Association has a support network where you can meet people who are on the same path as you. The right kind of emotional support can help your recovery be more manageable. Register at supportnetwork.heart.org, where you can read stories of hope and join online chats. You won't regret learning about one more resource. We all need a little help with our diet and nutrition, and food is a powerful tool to manage your diabetes. Check out diabetesfoodhub.org and No Diabetes by Heart with more than 1,000 diabetes-friendly recipes, free monthly live cooking classes, a meal planner, and tips from nutritional experts. These resources will help you feel more empowered when choosing better food options in your next meal. Share what you've learned today with a family member or friend. Tell them about the link between diabetes and heart disease and stroke, and encourage them to learn more. Thank you for joining. And remember, if diabetes is a new condition for you, or if you've been struggling with it for a while, know that you can start today by taking action and lowering your risk for heart disease for a longer, healthier life.